Welcome to The Explainer. Today, we're taking a seriously fascinating, kind of bustling geographic tour of a part of your body you probably don't think about nearly enough until it hurts, that is. We're talking about the neck. Forget the dry textbook anatomy you might be used to. We are going to look at this region as a dynamic, incredibly complex landscape. If you had to guess the most congested, high-stakes highway in the entire human body, what would you say? Well, it's actually this tiny stretch of real estate, right between your head and your thorax. This is an absolutely incredible anatomical bottleneck. Every piece of food you eat, every single breath you take, the vital blood supply keeping your brain alive, and the neural wiring controlling your entire body below the head, it literally all has to pass through this narrow, tightly packed cylinder. Here's our roadmap for today. First, the ultimate anatomical bottleneck. Then, the cervical backbone, mapping the neck triangles, vital infrastructure like the thyroid and trachea, and finally, the root of the neck. All right, part one, the ultimate anatomical bottleneck, evolutionary surprises and surface topography. Okay, let's dive right in. It is so easy to take our posture for granted, right? But the design of our neck is actually super unique in the animal kingdom. Our huge brains literally restructured our entire head and neck. Think about a dog. They're pronagrade. Their snout projects forward, guided by smell, sitting right in front of the cranium. But as we evolved into plantigrade creatures with higher visual and cognitive functions, our massive brains just exploded in size. And this actually pushed our face down, directly below the cranium. So what does this all mean? It means our neck now has to balance this really heavy, brain-filled bowling ball directly on top of a slender little column. To really grasp how we map this column out, go ahead and actually touch the front of your own neck right now. If you feel that prominent bump right in the middle, the Adam's apple, that's your thyroid cartilage. It sits right around the 4th and 5th cervical vertebrae. Now, drop your finger just a little bit lower. Feel that? That's the cricoid cartilage at C6. And if you keep going down to that little dip right above your breastbone, that's the suprasternal notch. Interestingly, this notch actually aligns with the 2nd and 3rd thoracic vertebrae, which marks our gateway down into the thoracic region. Moving on to part 2, the cervical backbone, the skeletal infrastructure. So let's go a bit deeper and look at the skeletal foundation holding that big brain up. We're essentially peeling back the skin and muscle here to look at the cervical backbone. You've got exactly 7 cervical vertebrae, and because they don't have to carry the massive, heavy weight of the torso like your lower back does, they're relatively small. But do not let their size fool you. Their architecture is incredibly complex. Just think about the structure of a typical cervical vertebra. You've got the split or bifid spine and a large triangular hole in the center, the vertebral foramen, which safely houses your spinal cord. But honestly, here is the most fascinating part of this bone. These vertebrae actually have little holes on either side, called the foramen transversarium. Try saying that 3 times fast. Anyway, the absolutely crucial point here is that this specific hole exists for one major reason: to safely route the vital vertebral arteries straight up the neck and into the brain. It's basically built-in bony armor for your brain's blood supply. Pretty amazing, right? All right, part 3, mapping the neck triangles, the geographic districts. Now, with so many arteries, nerves, veins, and glands packed so tightly around that bony spine, anatomists really needed a way to navigate. It's kind of like mapping out a bustling city. They divide the neck into clear geographic districts to make sense of all the congestion. And we draw these boundaries using the major muscles that stretch across the neck, creating specific geometric triangles. For instance, the large Sternocleidomastoid muscle, that thick band you can feel on the side of your neck when you turn your head, it divides the neck into a distinct anterior and posterior triangle. And within those main areas, we find smaller, super high-traffic zones like the digastric triangle. And let me tell you, the boundaries of this digastric triangle are incredibly precise. You've got the median line of the neck in the front, the sternocleidomastoid in the back, the jawline forming the base, and the apex pointing right down to the suprasternal notch. Why does this matter? Well, knowing these exact boundaries is absolutely essential for surgeons. Diving into this specific subdistrict means very carefully navigating around major facial vessels and glands. One wrong move, and, well, it's a big deal. And these muscular borders aren't just theoretical lines in a textbook. They are powerful structures that can drastically affect your day-to-day life. Have you ever woken up with a terribly stiff neck after, say, sleeping on a bad pillow? If so, you've probably experienced a mild form of torticollis or RIMAC. This is a very painful clinical reality where a spasm of the sternocleidomastoid and trapezius muscles literally forces your head to bend to one side while your chin points in the completely opposite direction. Moving right along to part 4, vital infrastructure, thyroid and trachea, the visceral compartment. So moving past the muscles, we reach the visceral layer. This is where we hit the heavy machinery of breathing and metabolism, sitting right there in the front of your neck. Let's talk about the thyroid gland for a second. It wraps right around the front of your trachea. And what's really mind-blowing is that the thyroid is the most vascular endocrine gland in your entire body, rivaled only by the adrenal medulla. We are talking about an immense volume of blood rushing through this tiny, tiny gland every single minute, which makes total sense given its massive job as the master metabolic regulator of your whole system. But what happens when things go wrong here? If the thyroid becomes enlarged, a condition known as a goiter, it often just doesn't have room to expand outward. Instead, it gets pushed downward, plunging behind the sternum and right into the upper thoracic region. This retrosternal expansion creates the terrifying 3 Ds of compression. We're talking dysphagia, or difficulty swallowing, because it literally crushes the esophagus, dysphonia, or hoarseness from pressing on the delicate laryngeal nerve, and dyspnea, which is dangerous breathing difficulty, caused by compressing the trachea against the rigid thoracic inlet. And finally, part 5, the root of the neck, the ultimate bottleneck. This brings us perfectly to the climax of our tour, the root of the neck. This is that critical transition zone right above the thoracic inlet, where the neck directly interfaces with the thoracic region. Take a second to just imagine this. You have major arteries pumping blood up to the brain, massive veins returning blood to the heart, the esophagus, the trachea, and even the delicate tops of your lungs, the cervical pleura, all shoved into this incredibly tight bony ring. It's bounded by your first thoracic vertebra, your first rib, and your sternum. So the ultimate question we have to ask is, what happens when you run out of room in this space? Well, the reality is, running out of room here has some pretty dire consequences. Several things can dangerously reduce this already tight space. An enlarged thyroid, like we just talked about, is one of them, but you could also have a rare extra rib, literally a cervical rib, crowding the area, or terrifyingly, a Pancoast tumor. This is a tumor sitting right at the apex of the lung, inside the thoracic cavity, that grows upward. It invades the root of the neck and basically crushes everything in its path. And when a mass like that Pancoast tumor crushes the nerves in this area, we see some truly striking clinical conditions like Horner syndrome. This happens when the cervical sympathetic trunk gets damaged. The patient will actually present with a drooping eyelid, a constricted pupil, a lack of sweating on one side of their face, and even a sunken eye. It is a perfect demonstration of how a severe problem down where the thorax meets the neck can vividly show up right on your face. As the renowned anatomist Vishram Singh puts it, the clinical importance of this area is that the numerous important structures are all packed together into this relatively small space. That quote perfectly hits the nail on the head and encapsulates the main theme of our explainer today. The neck is an absolutely brilliant piece of evolutionary design, but its extreme congestion is exactly what makes it so incredibly vulnerable. We have covered a lot of ground today, haven't we? From evolutionary shifts to muscular triangles and finally down into the super crowded root where the neck meets the thorax. It is a ton of machinery humming just beneath your skin. Next time you swallow, speak, or simply turn your head to look at something, I really hope you take a second to appreciate the crowded, high-stakes highway that is continuously keeping you alive. And since everything from the root of the neck plunges straight down, we're going to make a video on the thoracic region with all its complex details next time. Thanks so much for joining me on this journey through the human body, and I'll see you then.